Hi, my name's Laura, and today I'm going to be demonstrating how to perform a dressing change using sterile technique. And I'll be using my GPSP. Now, first, what I'm going to be doing is I'm going to be verifying my order, and I'm also going to be accessing my patient's medical chart for any kind of analgesics the patient may have or any kind of allergies that the patient may have. So first, I am going to gather my supplies, verify that order, and once I do that, I'm going to go see my patient. So I'm going to knock, provide for privacy, perform hand hygiene, and I am going to introduce myself, and I'm going to ask for that patient's name and date of birth. And I'm going to verify that name and date of birth by using his bracelets that he has on his wrist. And I see that, and I also see an allergy bracelet. So what I'm going to do is I'm going to tell the patient that I'm here to do a dressing change on his wound, and I'm going to ask the patient if they're in any pain. Now, if they are in any pain, I am going to ask the patient if they would like an analgesic or pain reliever. And if they say yes, then I'm going to go get their pain reliever, their analgesic that is in their chart, and I am going to use my 11 rights of medication administration, and their 3 safety checks of medication administration. And after I give that to him, the medication kicks in, then I am going to come back and I am going to ask the patient for permission to proceed with the sterile procedure. And after I have permission from my patient, then I am going to raise the bed to a comfortable working height for myself. And I'm also going to position the patient in a comfortable position for the sterile procedure. And after I do that, I am going to proceed. So I'm going to go ahead and set my patient up. So what I'm going to do first is I'm going to get my bed bath blanket. And I got a bed bath blanket for privacy and modesty. Now, my patient has a abdominal wound. So, okay. So I have that bed bath blanket positioned. I am also going to put a Chuck's pad under the patient's hairy area. And since it's on their abdomen, I would have them positioned kind of halfway so that any kind of drainage would fall onto the Chuck's pad. We put the Chuck's pad there because we don't want that to get on the bed, because that's just nasty and disrespectful. So what I'm going to do now is I'm going to perform hand hygiene once again. Now I moved the patient's legs over so that I would have an area to put my biohazard bag. I've seen some people put the biohazard bag on top of the patient's legs, and that's just rude. We're not doing that. So that was a clean biohazard bag to begin with. Never been used. And And I am putting on gloves. Okay, I now have clean gloves on. So now what we're going to do is we're going to take off that bandage. And I am going to take off the bandage by using the push-pull method. And I'm going to push on the skin while pulling the adhesive tape. So push, pull, push, pull, push, pull. And I am doing this all around the bandage. Now it is time for me to pick up that bandage. I am going to pull it from the middle. So I am assessing that bandage, and I'm going to use the taco method. And that taco method is an acronym, and it stands for type. It stands for, well, that's the T. T is type, A is amount, C is color, and O is odor. And I'm going to throw that bandage in my biohazard bag, which is placed on the bed. Now, I'm also going to be looking at that wound, and I'm going to look to see if there's any type of swelling. I'm assessing the wound for swelling, change in swelling, change in redness, if there is any at all, any kind of odor coming from the wound itself, any type of drainage, any kind of necrotic tissue, things of that nature. Now at this point I am going to take off my gloves because they are now soiled, and I am going to perform hand hygiene. Now, all right, now at this point, this is where we go from clean to sterile. All right, so I am going to begin my sterile field. Okay, I have now placed my drape on top of my table, and it is sterile except for 1 inch around the perimeter of my drape. That is not sterile. Now I am taking my container and I am dumping it onto my drape no less than 6 inches above my drape. There we go. Now, I can throw that away. I'm not using that anymore, so I can throw that away. Now, it's time for me to put on my sterile gloves. Now the same concept applies with the sterile packaging of the gloves as it does with the drape, 1 inch around the border. One inch around the border is not sterile. I'm going to complete my sentence on that. Okay, I'm going to begin by donning a sterile glove onto my dominant hand, so I'm right-handed. Okay. Now I am going to put on the other sterile glove onto my non-dominant hand. carefully. Making any adjustments over there. Okay. And now I can get rid of my paper because it is trash, and I'm just throwing it over there. So now what I'm going to do is I'm going to set up my sterile field the way I want to. Now I cannot let my arm go over my sterile field because that will contaminate everything. Okay, now I have my sterile area set up the way I want it, and I'm ready to clean this person's wound. So the way we're going to start now is I'm going to grab my swabs and clean the wound. I'm just going to pick these up because sterile touches sterile. And I'm going to grab my first one. And the way we clean this with the swabs is we clean top to bottom, and then and throw away, and then the outer edge, and then the edge closest to me. So we clean top to bottom, down the middle, throw away. Grab us another one, and then we go around, and we do top to bottom on the edge farthest from me, throw away, and then we do top to bottom closest to me, throw away, and throw away. Now it's time to dry, and we're going to dry it in the same manner that we just cleaned it. So I'm going to separate these a little bit. And it's okay that I do that because sterile is still touching sterile. Because I'm using tweezers. So I'm going to dry it from top to bottom. So top to bottom, pat drying, and throw away. I'm going to dry it from top to bottom on the side away from me, going around, not touching blankets or anything, top to bottom, throw away, and then grab some more. And I'm going to pat dry it on my side from top to bottom, and throw away, and throw away the tweezers. I'm done. Now at this point, my gloves are considered soiled, so I am going to take them off. So I throw those away, and I'm going to perform hand hygiene again. So I am going to put on another pair of sterile gloves to put on that sterile dressing onto my patient's wound. I can throw away my stuff. Okay. So, nice fresh pair of sterile gloves. The outside is not sterile, inside is. And again, I got a 1-inch border around my paper that is not sterile. Keep that in mind. So I grab the corners, I open it. Okay. And very carefully, I am going to pick up that glove. And be very careful about putting on these gloves. Okay, and now that I'm sterile, I'm going to put on that sterile dressing. So I'm just going to put that sterile dressing on. And now I'm considered, well, now this procedure is considered non-sterile. Okay, so now we are unsterile, and I'm just going to treat these gloves in this area as clean. Okay, so now I get the tape. I tape my dressing down, and I'm going to get a pen, and I'm going to write the date and time on my dressing, and I am going to clean up my area. Clean up everything as appropriate. I'm going to get my patient back to a comfortable position. I am going to put the bed back to a comfortable position of what my patient wants. And I am going to get the patient my call or his call light, and I am going to document what needs to be documented, report and record, and that's everything. Thanks for watching.